Hello, everyone. Welcome to our special presentation. This time we discuss heart and kidney patterns, which is quite relevant nowadays. So we shall try to do this um, as simple as possible so that everybody can understand what we're talking about. So the heart is actually a very interesting organ, no? In Western medicine, the heart and the brain are the two most important organs in the body. Diba? A person is declared dead when the heart and brain are no longer functioning. Okay? So the Western medicine, heart and brain, can be considered to be aspects of the same organ in Chinese medicine. So ang pinag-uusapan heart, kasama na pati brain. So even though we consider the brain as one of the six extraordinary full organs, and this is created from, di ba, galing sa kidney essence or kidney jing ang brain, it is nourished by heart blood. And much of its functionality in Western medicine relates to the shen. That is why, I'm sure you're familiar with dementia, no? With Alzheimer's.
Yeah.
Alam niyo ba ang cause talaga niyan? Mahina yung heart mo. So kailangan, we need to understand bakit humihina. So the heart and the brain are actually considered to be one aspect lang in Chinese medicine. So as you can see here, the heart is located within the upper jaw. Okay? Upper jaw, upper burner. Diba? And this is protected by the pericardium. No? So ito yung pericardium. Okay? So before maapektuhan yung heart, pericardium muna. So then this is the heart channel of the Han Shao Yin. Okay, napakaikli. Okay. And we consider the heart as the true emperor, no? It doesn't do that much in the physical day-to-day functioning of the empire, pero yung parang CEO, no? Its balance and health are crucial for the functioning of the whole realm, okay? So the heart opens into the tongue, so it is important that we need to master the tongue and it governs the pulse. So can you imagine? The heart opens into the tongue and the heart, yung feel talaga natin, that's actually the heart. Dinivide lang natin siya into several organs in TCM, no? So yun. And the function of the heart is to house the mind, no? Magiging residence ng mind. And consequently, this includes your mental activity, your consciousness, your spirit, and thinking, no? They all reside in the heart. Okay, you just have to go through this. This is to show you the common symptoms associated with the pathology, no? So the pathological changes, they manifest mainly as disturbances of the heart and also disturbances in controlling, as you can see here, controlling the blood, controlling the mind, controlling the vessels. No? Therefore, the common symptoms of heart diseases, number one dyan is palpitations, may chest pain, although there are only two patterns na may chest pain. They're very easy, no? So you just read that. And we have what we call the deficiency pattern and the excess pattern. And this is better appreciated when we do the pulse, no? So the brain is considered to be the mind of the heart. Huh? The mind of the heart. So meron tayong pattern in the brain collaterals that is associated with heart disease. Okay? So ang Shen naman, maingay. Okay. Ang Shen naman, it encompasses the Western concepts ng mind and consciousness. So when we have heart imbalances, they will always manifest na may changes sa Shen, no, ng pasyente, no? Ng mind, ng pag-iisip and consciousness. So, yun. Hanggang sa, and kaya may mga tao, may mga severe personality disorders. And ano ang nagdonori sa Shen, sa mind natin? It is the heart yin and heart blood. Okay? So kung mahina ang heart yin and heart blood, kulang ng nourishment ang Shen. So wala siyang routing. So this time, the patient will be easily startled and unsettled kasi hindi stable yung kanilang shen. Do you get it? So for those with heart yin deficiency and heart blood deficiency, madaling magulat yan mga yan. Okay? And the lack of anchoring will also cause the person to have difficulty sleeping or nervous, uneasy, and restless. Okay? So yung agitation niya will not only be mental, but it will also manifest physically with the person, hindi mapakali, yung mga ganon, no? So let's start with the first pattern, heart chi deficiency. So this is heavily shortened. Okay? So when you talk about chi deficiency, we're talking about hindi na siya performing at optimal level, no? So these are the key symptoms. Of course, pag may heart issue, there's palpitations, tiredness, kasi nga kulang ang chi, and the pulse is weak or empty, no? That's why it's called deficiency. So when you look at the tongue, it can be normal or a little bit pale, no? So the pulse will be empty or weak. In severe cases, you will notice that the heart pulse could be slightly overflowing and empty. So ibig sabihin napaka-superficial niya and somewhat pounding, but when you apply heavier pressure, nawawala. So what is the principle of treatment? We tonify the heart chi. So in Western medicine, this is the counterpart of heart failure. Huh? So heart failure or angina pectoris, arrhythmia, general asthenia, or neurosis. So, yun. So dapat dito pa lang, nalalaman mo na. Okay? And saan nanggaling ang heart chi? Bakit humina ang heart chi deficiency? Because the one on the left, mahina ang kidney chi at mahina ang gallbladder chi. Remember, Sir Mark, gallbladder is wood, di ba?
Yes po.
Okay, so ganun lang yan. Okay. So, if you do not correct the heart chi deficiency, magkakaroon ka ng heart yang deficiency. What did we learn last time? Pag may heart yang deficiency, they basically have the same symptoms as heart chi deficiency plus the feeling of cold and cold limbs. Yun lang po yun. So, mas malala na po ang heart yang deficiency. So, I'll just leave to you the points. Okay? And what is important here is we can best so ang goal natin is to tonify the heart chi. So it is best tonified at the emotional level. It is important that the person will meet somebody like Mercy and Sir Mark para magkaroon naman to cultivate the joy in their life. Of course, no, this is easier said than done. As well as working with their emotions, the person can try to spend some time each day doing something that gives them genuine pleasure, like listening to good music, no, or doing some reading, no, or they can sit and meditate on something that for them is beautiful. Okay. So when you tonify chi in general, that means the whole body, the chi of the whole body, this will also benefit the patient. So how do you do this? You have to do this sa diet, no? Access to fresh air. Yung iba sa atin nakalimutan ng huminga kasi nakatira parati sa loob. Breathing exercises, no? As well as getting enough rest and avoiding overexertion. So how do we deplete the heart chi? How can heart chi be depleted? It can be depleted through excessive sweating. No? This means that we cannot recommend the use of sauna and steam bath kasi magpapawis ka niyan. So it's not for everyone. So it is important that you have to be able to diagnose heart chi deficiency. And the patient, of course, should avoid to use recreational drugs. I think you know what I mean. Medicines and experiences that spread heart chi. Kasi napapagod si heart chi pag masyadong maraming stimulants, no? Yon, nauubos si heart chi. I hope that's clear. Let's now proceed to the next pattern. Heart yang deficiency. So the key symptoms are, still you have palpitations, cold hands. Wala ito sa heart chi deficiency. Okay? Deep and weak pulse. Deep kasi internal na, no, malalim, saka empty or weak pulse, no? The tongue is pale because deficiency nga, and slightly wet. Remember, if the hands are cold, expect the tongue to be slightly wet. So the pulse is deep and weak. In severe cases, knotted. You know, knotted, nakabuhol-buhol. So principle of treatment, of course, you have to tonify the heart yang and warm it, no? Tonify and warm the heart yang. So saan ba nagmula ang heart yang deficiency? Okay, as you can see, parating star si kidney. Kaya sinabay natin yung discussion ng kidney and heart. So this can derive from kidney yang deficiency, and also yang deficiency of the stomach and spleen. We have discussed that very lengthily last time, no? So if you do not correct the heart yang deficiency, it can become heart blood stasis, no? So in other words, heart yang deficiency is a deterioration of heart chi deficiency. So talagang hindi na gumagana. So hindi tumatakbo, so magkakaroon ka ng blood stasis. Okay? It is important na we have to protect the young, and the young should not be further burdened when there is heart-yang deficiency. This means, anong ibig sabihin nito? The patient should avoid consuming food and beverages that have cold energy or temperature. No? People kasi tend to drink cold beverages pag mainit. That cannot be the case if you have heart-yang deficiency. At the same time, they must not overexert themselves, and men should avoid having too much sex. So guys, take note, not too much sex. Heart yang kasi can be damaged by, again, excessive sweating. Therefore, we cannot recommend saunas and steam baths. So you have learned two patterns so far. Next is sudden collapse of the heart yang. So from the pattern, the name of the pattern itself, you would know what happened. Nag-collapse na yung yang. Hindi lang siya deficient, tumigil na. So this time, there will be cyanosis of the lips. Akala mo nag-lipstick siya ng blue, pero it's actually blue lips. And the pulse are nagtatago, hidden and minute. Parang wala. So tinan mo yung lips niya. And of course, the limbs are cold, because this is an aggravation of heart yang deficiency. So when you look at the tongue, it is very pale or bluish purple and short. Short, parang umurong na. Sige, tinandun yung mga tongue nyo. Dapat pasalamat kayo kay Lord kung hindi pa umuurong. Principle of treatment, you rescue the young, restore consciousness, kasi some of this medyo nawawala ng malay, and stop sweating. Wag talaga. Kasi 'di ba, like we've seen some celebrities na grabe ang sa gym. So hindi pwedeng mag-over sweat, no? Oo. And so what happens is, saan nanggagaling yung heart yang collapse? When you already have kidney yang deficiency and yang deficiency of the stomach and spleen. No? So there will be heart blood stasis if uncorrected. This is usually an acute pattern, therefore, hindi relevant ngayon ang lifestyle and dietary advice. It is important that the patient does not sweat because this will further weaken the heart yang. Clear? Sa inyo na yung points. Okay. Next, we go to heart blood deficiency. Okay, let's make some comparison, ha? Oo. Di ba all heart patterns will have palpitations? So let's differentiate the palpitations from heart chi deficiency and heart blood deficiency. So pag tinanong mo ito sa pasyente, kailan yung palpitations mo mas frequent? Sa gabi or sa araw? No? So pag sa araw, no? That's heart chi deficiency. Pag yung palpitations siya more common in the afternoon or evening, that's heart blood deficiency. Okay? Key symptoms, palpitations, again, Insomnia, o pumasok na si insomnia ha. So meron ka na blood deficiency. Matagal makatulog, no? Poor memory, okay? Remember, hindi na nanonourish ng dugo ang utak. Okay? Poor memory. Pale tongue, no? So the tongue will be pale, thin, kasi kulang na nga ng blood, and slightly dry. The pulse is choppy, parang nawawala, no? Or fine. So principle of treatment, because this is heart blood deficiency, you nourish blood, tonify the heart, calm the mind. Di ba, we mentioned earlier na kailangan ng mind ang blood and yin. Ito kulang yung blood. Kaya medyo hindi siya makatulog, poor yung memory. No? So where did this come from? The heart blood deficiency came from liver blood deficiency. Remember, liver, the wood element, is the mother of the fire element. So, if you have liver blood deficiency, you can have heart blood deficiency. And when you have heart blood deficiency, hindi ka nagpa-acupuncture, it can either go to heart yin deficiency or spleen blood deficiency. So when there is heart blood deficiency, it is important to eat a diet that nourishes your blood. Okay? So what are the things that nourish the blood? Ito yung mga green leafy vegetables, beetroot, seaweed, dates, kidney beans, black beans, aduki beans, red meat, bone marrow, blood, sausages, heart, and liver. The patient should avoid sugar. Take note. Huh? Diba, yung shen mo restless, kaya nagkakaroon ka ng craving, maputla ka na nga, mayroon ka ng heart blood deficiency, mahilig ka pa sa sugar. Okay, so you have to think of something else. Or acupuncture mo. I had a patient last week, sabi niya hindi na siya nagkikrave ng sugar. So, yun. Nagbigay pa ng pad thai, o, di ba? Nalibre pa ako ng dinner. Kaya dapat ganyan kayo. Pag nagbibigay na ng food yung pasyente mo sa second or third visit, that means the patient likes you, no? So the patient should avoid sugar, stimulants like coffee, and too much alcohol, no? The patient should not only eat a diet rich in blood nutritious foods, but they should also eat a diet that is beneficial for their spleen qi. This means, kailangan ko kumain ng warm prepared food such as soup. Sanayin yung sarili nyo kumain ng soup or humigop ng soup before meals, no? Bake stews, yung mga matagal lutuin, bake vegetables, and avoid salads, no? Raw food and food. Lalo kayo mamumutla niyan. Okay. Raw food and beverages. Kasi meron siyang cold energy and they produce dampness. Okay? Next. So we're done with heart blood deficiency. Now let's go to heart yin deficiency. Alam natin na yin deficiency can lead to empty heat. But before it happens, dadaan mo na ng maraming taon. Usually 8 to 10 years. So this can occur for a long time without empty heat. So we'll not discuss it. Alam naman natin pag may empty heat, yung tongue mo red na, wala ng coating talaga. So doon muna tayo sa no coating, di ba? So the tongue, remember this is yin deficiency, no coating, and there's a deep midline crack reaching the tip. No? So key symptoms, again, palpitations, mental restlessness, night sweating, tongue without coating. So as contrasted to heart blood deficiency, wala ng coating ang heart yin deficiency. Pulse is floating, empty. Principle of treatment, nourish the heart yin, of course, calm the mind. No? So if empty heat is pronounced, you clear the empty heat. So as you can see here, saan ba nanggaling yung heart yin deficiency, kidney yin deficiency, or liver yin deficiency? Okay? So doon lang talaga, pabalik-balik lang. So ang question is, what weakens our heart yin? Paano humihina yung ating heart yin? This is weakened by prolonged mental and emotional stress. Okay lang yung paminsan-minsan, pero kung mahaba na, ilang taon na, anxiety, worry, and fear. Lack of sleep, excessive thinking, and use of the brain and general overexertion will all deplete the heart yin. Okay, what else can deplete our heart yin? If you use too much stimulants like coffee, no? And also some medications na may hot and spicy dynamic. Okay? So this could injure your heart yin. So if you eat excessive food and beverages that have hot or spicy dynamic, like ano bang example niyan? Alcohol and chili, nakakasira yan ng yin. No? What else? Yung mahilig mag-party, no? Too many late nights and too much acceleration, ginagawang araw yung gabi, this will consume your heart yin. And also the use of computers, smartphones, no? And watching television. This will overactivate the mind. So pag na-overactivate yung mind, nauubos si heart yin. So this effect will be even more pronounced in the evening. So bawal naman noon sa gabi. Okay. When heart yin should be tranquil. Kasi dapat natutulog tayo sa gabi. No? Yung heat from fire and excess heat conditions in the body, pwede siyang umakyat sa taas, sa heart. And so this will injure the heart yin. No? So pwedeng mag-generate yung heat and fire internally or the result of invasion of exogenous pathogenic factor. Okay, pwede din nagkaroon ka ng inherent tendency to have heart yin deficiency. It can also be the consequence kasi tumatanda na yung pasyente, no? And also the general weakening of the kidney yin. Okay? In general, yung kidney and heart yin, they cooperate closely. Okay? Ang kidney yin should nourish the heart yin, ensuring that heart fire does not become excessive and uncontrollable. Kidney yin deficiency often results in heart yin deficiency. So if you have yin deficiency in one or more of the other organs, this may eventually weaken the yin generally in the body, and then this will lead to indirectly to heart yin deficiency. Okay? Next is heart fire blazing or yung tinatawag nating heart fire hyperactivity. Ang daming apoy. So, ito yung mga tao na mayroong mga tongue ulcers, nagkakasugat-sugat yung dila. So that's definitely heart fire blazing. There's thirst, of course, palpitations, and the tongue is red. No? So
Doc?
any questions?
Yes, Doc. Kasi Doc, yung sa cancer patient ko, meron po siyang, yung sa tongue po niya sugat-sugat.
Yung sa cancer naman po kasi, dahil po yan sa toxicity, no? Okay, kung nagkikimo siya, so definitely may nangyayaring maraming activity. So magkakaroon siya ng maraming apoy, no? In fact, if you look at the tongue closely, marami kang mga red spots na makikita. And minsan nawawala yung coating ng tongue. So dahil nagkakasugat-sugat, dahil wala ng coating, pula na yung tongue. Okay? Or red yung, sorry, pag walang coating pala, yin deficiency, yellow yung coating niya pala. Don't confuse this with yin deficiency. Yin deficiency is a deficiency condition. This one is an excess condition. Okay? So yon, ang goal na lang natin pag cancer is how to eliminate the heat at saka makatulog siya ng mabuti at saka mawala yung side effects. I'm seeing a doctor now who's being treated for her stage 3, no, colorectal. She sees me because para mawala yung side effects ng chemotherapy niya. So far, so good naman. Nag-refer din ng pasyente, o di ba? So dapat sana all, ha? So mag-attend kayo sa Monday kung matutuloy. Let's ask the president. Okay. Okay, so the pulse, so kung titingnan, did that answer your question, madam? Nawala na. Okay.
Opo, Doc.
Sige, ask again po, Yung iba, wala
Opo,
nang questions. Oo. Okay, full, rapid. So nakikita nyo, swollen with red points. Siguro ganito yung tongue niya po. No? Merong midline crack reaching to the tip. So the pulse is full. Check nyo yung pulse, super init yun, bounding talaga. So dapat may ginawa kayo na treatment, nawawala yung, hindi na mainit. No? Mawawala din yung mga singaw-singaw niya. Good luck po. So you know the points here. Full rapid overflowing, especially on the left front position. This is the heart position. It could also be hasty, which is rapid and stopping at irregular intervals. So, principle of treatment, clear the heart, drain the fire, calm the mind. Okay, ganito. Talking about bitter taste. If the bitter taste occurs every day, that's liver fire or gallbladder fire. No? Pero kung the bitter taste comes only pag hindi siya nakatulog the night before, that's heart fire. You follow? So kung the whole day siya, can you imagine, mapait yung panlasa mo, no? Kakaawa, di ba? So where did the heart fire blazing come from? Liver fire. Kasi yung liver is the mother of the heart, right? And so if you just leave this alone, magkakaroon ka ng heart yin deficiency, pwedeng maging spleen heat, kaya nagkakaroon ng mga singaw-singaw. Ito na po yon, stomach fire, mga sugat-sugat sa dila, minsan dito sa ano. So the patient should avoid all food and beverages that create heat, no? So katulad ng alcohol. How many of you eat lamb, no? Mainit na karne yung lamb, ha? Chili and other hot spices. Deep fried food, dark chocolate, mataas ang heat niya, no? Garlic, no? The heart is already overstimulated sa pattern na to, and therefore, it should not be further stimulated. So that means coffee, black and green tea, or anything na may caffeine and other stimulants must be avoided. Next, we go now to obstruction of the heart vessel pattern. Okay? Madali lang ba intindihin? May barado na po yung heart vessel, no? So key symptoms, sharp or stabbing chest pain. Actually, there are only two patterns sa heart na merong chest pain. Huh? So if the patient comes to you because of chest pain, so it can be either this pattern or heart blood stagnation or heart blood stasis. Are we clear? So tingnan nyo po, purple lips and breathlessness. When you look at the tongue, it's purple on the sides, in the chest area, swollen with a sticky coating. Ang pulse niya, wiry, choppy, or knotted. Kung predominant ang phlegm, it is slippery. Principle of treatment, move the heart chi and heart blood, eliminate stasis, open the chest, resolve phlegm, expel cold, calm the mind. As I mentioned earlier, itong pattern na to, plus heart blood stasis, these are the only two heart patterns na may chest pain. Okay? So there are four patterns sa obstruction of the heart vessel alone. Blood stasis, phlegm retention, cold obstruction, and chi stagnation. You just have to read through this. Okay? So maraming causes kung bakit nagbara yung blood vessel. Okay? So, as you can see here, saan ang galing to? Dahil sa chi stagnation, sa stress. So bawal na ma-stress. And also when you have spleen and kidney deficiency. So pag hindi mo kinorek yung heart vessel obstructed na pattern, magkakaroon ng dryness. No? So anong beneficial sa mga pasyente? Light physical activity lang po. So yung mga may chest pain, hindi na sila dapat masyadong overwork. It is important that the person does not overexert themselves if there is an underlying deficiency pattern. Pwede mo ring ipukpok yung chest and the upper back, no? With a loose fist, o pwede kang gumamit ng wooden spoon, or rolling the shoulders and swinging the arms, no? So get adequate exercise. And they should also get sufficient rest and relaxation. They should avoid stress and overexerting themselves physically. Kung naglalaro sila ng sports, it is important that they do not expose themselves to the cold when they sweat. Sino dito naglalaro? Bawal mag-expose sa cold pag nagpapawis kayo, no? They should avoid foods that create dampness and phlegm. Next, phlegm-misting the heart orifices. Now, this one is very common kasi ang daming taong may phlegm. Alam nyo ba ang phlegm, medyo minsan kakatopa ka na, no? So key symptoms, mental confusion, rattling sound in the throat kasi parating may phlegmas, swollen ang tongue with sticky coating. Okay? So, minsan may makikita kang heart crack. Okay? The pulse is slippery, so principle of treatment, open the heart, resolve phlegm, open the mind's orifices. Okay? And here, nanggaling po siya, mahina ang SLK, spleen, lung, and kidney. Okay? So, what I'm saying is, pag slippery ang pulse, dapat nag-change, no? Next, the patient should avoid eating a diet that is damp and phlegm-producing. They should ensure that they get a lot of fresh air and physical activity, no? They should also try to address the underlying emotional things. So dapat, kung ano yung problema mo, ayusin mo na. Magaling dyan si Sir Mark, saka si Ma'am Mercy. Okay. Phlegm-fire naman, harassing the heart. Ito na yung mga nagwawala na, no? Yung parang so you can have all the various mental symptoms. Mental ha, parang nasisiraan na ng bait. And when you look at the tongue, it's red with sticky yellow coating. The tongue may have a deep hard crack. The tip may be redder and swollen with red points. So pulse, full, rapid, slippery. So dapat kung rapid siya initially, pagkatapos mong in-needle, hindi na siya rapid. Okay? Are we good? So turuan mo.
Yes.
O tinan mo, madam, alam mo na sira ulo na. So, phlegm slippery. Sabihin mo na lang, kasi may phlegm-fire eh. So kailangan mawala yung fire. Now, phlegm kasi can obstruct the mind. And this can cause either mental dullness or mental illness. Kailan ba yung mental illness? If the phlegm combines with fire. Okay? So yon. So try to master this, pericardium 5 and stomach 40. This will resolve phlegm from the mind. If possible, you should see the patient every other day or twice a week. No? So here you could see na doon pa rin si spleen, lung, and kidney. So if pabayaan mo, mawawala yung coating at the same time, magkaroon ng blood stasis. The patient should avoid consuming anything that creates heat like chili, pepper, garlic, dark chocolate, alcohol, too much red meat, especially lamb, no? Mainit yung lamb. Tupa ba yung lamb? Fried food, katulad ng mga crisps, chips, falafel. They should also avoid phlegm and dump-producing foods like sweets, sugar, wheat, dairy products, bananas, avocados, bawal sa kanila avocados, and dried fruit. And kailangan hindi ma-agitate ang shen by coffee. So, bawal na ang coffee. Okay? Next, blood stasis obstructing the brain collaterals pattern. Ito yung blood stagnation. So, meron ng stabbing pain in the chest, cyanosis of the lips, purple tongue. Okay? So, ang tongue niya talaga, buong purple talaga yan. So, maghanap kayo ng mga taong may ganito. Tingnan nyo. Angina pectoris, coronary heart disease, MI, myocardial infarction. So kung yung tongue niya maputla lang, hindi pa purple, medyo malaki-laki pa magagawa natin, no? So the pulse is choppy, wiry or knotted. Principle of treatment, move the blood, eliminate stasis, tonify and warm heart yang, calm the mind. Okay? So ito po ang causes ng heart blood stasis. Can you see? Heart yang deficiency, liver qi stagnation, heart qi stagnation. So all of these can lead to phlegm. Okay? Kaya yung mga may heart blood stasis, kaya pag may phlegm, barado talaga yung circulation. Emotional problems, particularly anxiety, grief, or worry over a long period of time, this can lead to blood stasis. The chest is a part of the body where pent-up emotions are frequently kept, and they therefore easily lead to impairment sa circulation of qi and blood in this area. So all these emotions, they disturb the mind. So heart blood, na-mention natin earlier, is the physiological basis for the mind, and any emotional problem that constrains the mind may lead to stagnation of qi and or blood of the heart. Okay? And finally, we will only discuss one pattern sa small intestine, excess heat. Okay? Okay, merong abdominal pain. So pag may abdominal pain, definitely that's already small intestine. Can you see bakit natin pinartnered sa heart? Because heart and small intestine, they're internally, externally related. Okay? So you will have tongue ulcers, tapos yung ihi mo, kokonti lang, painful and dark. Okay? So key symptoms, abdominal pain, tongue ulcer, scanty, dark, and painful urination. So when you look at the tongue, it's red with redder and swollen tip, yellow coating. Okay? Pulse is overflowing rapid. So dapat hindi siya maging rapid at saka hindi siya mag-overflowing para mamangha yung pasyente mo. No? So if there are urinary symptoms, the pulse would be wiry on the left rear position. Possible presenting condition would be UTI. So this is actually UTI. No? So full heat in the small intestine can arise from heart fire. So this can also lead to heart fire as well. So food and beverages na may hot energy should be avoided. Bawal na yung too much meat, spices, alcohol, kasi this can lead to full heat in the small intestine. Pero kumakain pa rin, no? So when you have heat in the small intestine, this is usually associated with stomach heat. Pwede ring emotional strain resulting from anger, frustration, resentment, and worry. This can lead to heat in the small intestine. Okay, so in this case, the heat in the small intestine is associated with heat in the heart at the channel level. Okay, now, yung mga tao dyan, sino dito ang hindi masaya? Hindi masaya since childhood. Pwede kang magkaroon ng heart deficiency condition. Kasi nga, iba kailangan kasi ng heart blood ang utak, ang shen natin. No? Okay. Yung mga mahilig mag-party dyan, kain ng kain sa labas every night, this will overstimulate the heart. So, nagdi-dissipate yung heart chi, therefore humihina yung heart chi. So, magkakaroon ka ng heart chi deficiency. No? At saka, constant stimulation ng shen, hindi rin maganda, lalo na pag ganito mga bawal na gamot, yung mga sigarilyo, yung mga ganon, no? Kasi na ano ka na, nalulung ka na dyan, no? So this can give you heart chi deficiency and heart yin deficiency. Napapagod yung yang aspect ng heart. Yung mga galit, pag hindi mo nilabas, magkakaroon ka ng liver chi stagnation and mag-i-stagnate sa chest and the heart. So magkakaroon ka rin ng heart chi stagnation. So liver chi stagnation, pwedeng magdulot ng liver fire, pwedeng umakyat sa heart, so magkakaroon ka ng heart fire kung magwawala ka. Okay. Now, yung mga may melancholy and sorrow, this will directly affect the heart and humihina yung lung chi mo. So pag humina yung lung chi, what will happen? You will have chi stagnation, chi deficiency, phlegm, no? And thereby in the heart. Okay? Speculation and worry, nag-alala ka, no? Parang mas marami nang alam yung iba kaysa sa akin. Hindi ka nagkakaaral eh. So this will bind and weaken your spleen chi. Siyempre pag nanghina yung spleen chi, you will have chi deficiency, blood deficiency, phlegm dampness. All of this will affect the heart. Fear, takot ka. Lalo na pag matagal na, humihina yung kidney chi mo. So, magkakaroon na ng disruption sa communication between the heart and kidneys. Therefore, this will influence the production of chi and blood. Shock, naka-witness ka ng murder. This will weaken significantly your heart chi. Magkakaroon ka ng heart chi deficiency. The heart is nourished by joy. No? So kung hindi ka nakaranas ng kaligayahan like love and affection since childhood, no? Kasi when you were still young, hindi pa masyadong develop yung heart mo. So eventually, paglaki mo, pagtanda mo, magkakaroon ka ng heart imbalances. Okay? Stress will always affect the shen. So pag affected yung shen, affected yung heart chi and heart yin. Stimulants, katulad ng drugs, no? Coffee, and some types of pharmaceutical. Kaya nga, kung hindi naman kailangan, wag ka na muna. Try mo muna magpa-acupuncture, di ba? Pero kung may maintenance na, dahan-dahan nung ano yan. Pero dapat may permission ng doctor mo. Okay? It can overstimulate the heart. So, mauubos si heart chi and si heart yin. No? So, I want you to read this on your own. Like old age is inevitable. So humihina talaga yung heart. Phlegm. Pag marami kang phlegm, madidepress ka. No? The person will have difficulty connecting to other people. Kaya nga, pag tingin mo pa lang sa pasyente, parang ayaw niya mag-open up, no? Definitely may phlegm yan. So most likely affected yung heart chi niya, no? So you see, heart chi stagnation and blood stagnation can result in a person, Shen, having difficulty emanating outwards and connecting to other people. Sa yung mga kulang sa joy sa buhay, no? Hindi na nag-i-smile, meron yang chi stagnation sa heart. Okay? So I want you to read through that. What I'm excited about is the next one. Let's now go to the kidneys. Okay? Do you agree that most people, especially Filipinos, we love salty food? So the kidney resides in the lumbar region, as you can see. It is related to the bladder in both the interior and exterior via the channels and collaterals. Ang kidney ang nag-dominate ng bones, no? They produce marrow and fill up the brain, and then they open into the ears, control the lower orifices, and manifest in the hair. Okay? Ang trabaho ng kidney is to store essence and govern growth, development, and reproduction. The kidney yin and kidney yang are the fundamentals ng yin and yang of the whole body. So we consider the kidney as the root of as the foundation or the root of the congenital constitution. No, it is what makes you you. Storage is the kidney's nature. So primary yin and primary yang should not be stored and not used for consumption exorbitantly. Ibig sabihin, kung meron kang time deposit, dapat hindi mo siya binabawasan. Furthermore, the kidney also dominates water metabolism and the receiving of qi. Then yung partner niya, the bladder, the water's officer, it functions to store and discharge urine. So the primary pathological characteristics of kidney diseases, they manifest as abnormality in growth, development, and reproduction, and governing water, and failing to grasp the qi. So I would like you to take a look at this. You have the physiological function, what happens when there are pathological changes, and the common symptoms. No? The kidney does not have excess patterns. So madali lang, na puro deficient. So all kidney patterns are the deficiency type. Okay? Let's start with the first one. Kidney yang deficiency. So there is backache, a feeling of cold, kasi nga yang deficiency, no? And a weak kidney pulse. These are enough to diagnose kidney yang deficiency. And take note, kung kulang siya sa libido, ano kaagad yan? Kidney yang deficiency. Okay? Pag meron naman siyang empty heat within the kidneys, excessive sexual desire. So again, kung walang gana, kidney yang deficiency. Kung sobra, meron ng empty heat within the kidneys. So, ibig sabihin, may yin deficiency with empty heat. Clear? So key symptoms ng kidney yang deficiency, backache, feeling of cold, abundant clear urination, pale tongue, deep pulse. So the tongue is pale and wet. The pulse is deep and weak. So pwedeng manggaling sa spleen yang deficiency and dampness. Kaya yung mga mahilig kumain ng mga matatamis, no, damp producing food, this can weaken your kidneys, no? So remember, if you have kidney yang deficiency, you can have yang deficiency of the spleen, stomach, lungs, and heart. The patient should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature. In practice, you have to avoid fruit unless it is boiled or baked. So dapat binoboil mo yung fruit or bake. Salad, avoid ka, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing food, katulad ng oven bake and grilled dishes, which are more warming than steamed and cooked dishes. Okay? Next, we go to kidney yin deficiency naman. Okay? What did we learn pag may yin deficiency? Merong night sweats, no? So kahit night sweats lang yan and backache, that's already kidney yin deficiency. Easy? So tanungin mo kaagad, meron siyang backache. Tapos mainit ba pag gabi? Oo, night sweating. So that's kidney yin deficiency. Okay? So key symptoms, backache, night sweating. So ang tongue, normal colored without coating. Pulse is floating empty. So again, pwedeng manggaling sa liver yin deficiency and liver blood deficiency. Okay? So nourishment pa rin. So if you remember the topic on yin deficiency, you would know what to do. Okay? So these are the points. Next, we go to kidney essence deficiency naman. Okay? So key symptoms for children, poor bone development, hindi lumalaki. For adults, weak knees, falling hair, kahit bata pa, weak sexual activity, tongue without coating, no? Nourish the essence, tonify the kidneys. A person who is kidney zinc deficient must ensure kailangan nila ng enough rest and relaxation, and bawal sa kanila maging mentally stressed or physically, no? Men should avoid having too much sex. Pregnancy and childbirth, bawal na masyadong maraming anak, no? This will further weaken the yin in a woman who is yin deficient. They should avoid stimulants, especially coffee and caffeine. Foods that are attributed yin nourishing qualities are royal jelly, eggs, raw. Sino ba yung kumain ng raw? Si ano pala yung mahilig na kumain ng, ay oo, mga social, okay. I'm sure alam niyo yung raw, caviar, no? Oo. Fish egg.
Medium rare steaks.
O, diba? So, yan ang,
Sashimi po. Sashimi.
okay. There's propolis. I'm sure you're familiar with that. Bone marrow, brain, kidney, oyster, seaweed, algae, artichokes, raw milk, oats, no? Now let's go to kidney chi deficiency pattern. This is also known as kidney chi not firm. Okay, you ask the patient, pagkaihi mo ba, mayroon pang tumutulo-tulo? Oo.
May
Or basta
pahabol.
brief mo, oo, may pahabol. That's kidney chi deficiency or kidney chi not firm. Okay, sa babae naman, chronic vaginal discharge and backache. Now, backache talaga classic yan for kidney. The tongue is pale, pulse is deep, weak, especially in the rear positions. Okay? Principle of treatment, you have to reinforce and stabilize kidney chi, raise chi, tonify kidney yang. So tingnan nyo, saan siya nanggaling? Kidney yang deficiency. It can also result to kidney yang deficiency. So what do we advise patients with kidney chi deficiency or kidney chi not firm? Listen, men should avoid ejaculating and women should avoid becoming pregnant. The patient should avoid lifting heavy objects and working too hard or placing a physical strain on the body. They should eat a diet that strengthens kidney yang. Okay? Next, we go to kidney failing to receive the chi pattern. This is the reason why yung sinasabi nila ay, bakit nagka-asthma nung tumanda na? Hindi asthma yun. Actually, yeah, asthma, COPD, actually affected na yung lungs mo dahil mahina yung kidney. Okay? So you see, the possible presenting condition, chronic cardiopulmonary failure. Cardiopulmonary, lungs, no? So shortness of breath on exertion, lower backache, clear urination. Okay? So may backache, lower backache, shortness of breath on exertion. Clear urination. Tongue is pale, so the pulse is deep, weak, and tight. No?
Dok, iba din po ba yung inborn asthma?
Iba din yun. Yun yung mga merong lung and spleen chi deficiency. Parang na-inherit na nila yun. So ito naman, we're talking about, kung nakikita nyo yung picture, hindi naman siya bad. Ito yung iba na hindi talaga nagka-asthma before, pero nung tumanda na, dahil mahina yung heart, pati yung kidney, parang actually shortness of breath yon. So, you see, we should treat the kidney. Number 1, kidney 7. No? See? Where was this pattern derived from? Kidney yang deficiency and lung qi deficiency. Okay?
Doc, pwede po magtanong?
Sure.
Po, Doc, kasi di ba tama po yung sugar kasi can cause damage dun sa kidney. And
Mhm.
how about the salty food?
I'm sorry, salty food.
Opo, yung mga salty food po, Doc.
Oh, yeah.
Di maalat.
Actually, ganito yan, no? If you study the 5 elements, kaya nga I'm inviting you all next week. I think that will be on Tuesday, no? Tuesday ba? Yeah, Wednesday. Yeah, Tuesday. We will actually Tuesday and Wednesday. Yung actually salty foods hindi pwede sa mga may heart problem. Okay? So ibig sabihin, at saka 'di ba, like if you have a heart issue, affected din yung kidney mo. Kasi they should have a communication. Okay? Makes sense? Pero
Yes, Doc.
definitely, too much salt really is bad. Pero did you know that to strengthen the kidney, you need to have salt?
Yes,
Mhm.
Yeah.
Doc.
So, but salt is bad for the heart. So, ganun pa rin. So, if you affect the heart because you eat too much salt, then definitely it will affect your kidney. Diba? Oh. So, sige, we will talk about that. Yung mga salty na yan, yung mga taste. When we discuss the 5 elements, when hopefully we could meet, no? Okay. For the benefit of those, parang medyo maiba naman, for those who came late, next week, I'm still thinking of doing, for those who haven't attended the pulse and tongue diagnosis, this time it will be different. We're going to make it too detailed, too clinical, para pag uwi mo, nakangiti ka, ganun pala. So, and you feel so
Mhm.
good because you already know what you're doing. You know, this is the
Mhm.
hardest thing to treat. I still cannot find anyone who teaches this from the heart, no? This is the kind of patients that we want to have. This time they will be very discriminating. We will teach them how to check their pulses. And if you came in, by the way, this time the patient will now wonder, how come you didn't check my pulse? You're not legit, no? How come you didn't look at my tongue? Diba? Okay. Now, let's say you know how to check the pulse. Pero when you treated the patient, like after 2, 3 needles, walang nakitang change sa pulse. Oh, you did not train with lamp, no. Sorry. I guess I have the right to look for another clinician. I'd like to call ourselves clinician, no? Iba kasi yung therapist sa clinician. Okay? You should be both. Do you get me? And then also, yun na ang magiging trend. In fact, our theme, LAMP's theme for next year is growth, evolution, transformation. This year is innovation. Okay, yung transformation was suggested by Dr. Ryan. But I felt na, how can you transform if you haven't grown yet? Oh, di ba?
Yes.
Okay, so let's reach for the stars.
Exciting.
Sige, please help us spread this kind of mentality, no? Like, you have the money to buy luxury brands, no? You should understand, bakit mahal siya? Okay. Diba it's not fair? You paid mahal for a luxury brand and it looks fake, no? You feel so shortchanged, sorry. But this time, magko-compare na, no? It takes, kaya nga, on Wednesday, that will be 23rd, ano ba yung title? Pag pinopost ni Sir Albert eh. Yung title is How to Teach Your Client the Art of Pulse and Tongue Analysis. And then marketing tips. I'll teach you techniques on how to make your patient like you and how to give a very good impression. When you
Nice.
give a good impression, that means they would want to bring their patient the next time they come back. Their parents or their boyfriends or wives. No? Are you all excited? That's something that we should master. No? Yeah. This is not about displaying your certificates there. They don't care about it. What they want is result. Okay? Okay, yung mga nag-attend before, doon ko nakita yung yung pagkakamali ko, no? I think we need to really make the presentation of the 5 elements in a very clinical way kasi this is what we will be doing eventually, di ba? And then we will also discuss the TCM organ clock and then of course the channels, no? And we will give you cases. And we will also, of course, when you talk about the 5 elements, this is not just knowing the Zangfu, ano ba yung wood, that's basic. Ang importante, what will I advise my patient if, kasi di ba, sa 5 elements, we have 4 cycles, remember? We have the Wu and the Chang cycle. Yung pinaka-pathologic doon, yung over-controlling, at saka yung insulting. Okay? So, aside from giving the patient, recommending a diet, you should also tell the patient what not to eat. No? Okay. Yeah. Excited. So, kasi October na, magdi-December. By January, we will not have lectures December, ha? Break tayo. Siguro konting webinar lang, siguro until first, second week. And we would like to welcome batch 3 for your TCM foundations. You will love it. And also batch 2, we welcome you to acupuncture channels and point categories. And by the way, I'll give a summary of that on Wednesday then. So by Monday, for those who haven't attended our tongue and pulse yet, and also how to assess patients. On Tuesday, it's all about heart and kidneys. Diba number 1 yung heart disease, no? And we want people to be aware na, ay, bakit wala na akong heart pulse? Bakit ang lalim? Bakit, hesitant yung pulse, nawawala, na nagiging irregular? Oh, no? Or bakit choppy? Imagine mo, ganun yung mga pasyente mo. Help me now. Di ba? Okay? That's why, my God, the effort nito, ha? Tingnan nyo. Hindi ko na i-discuss yung isa-isa. And the amazing thing here is, yung sa ear. This one is for the body if you want it. But you can also use the ear. And I made a discovery, a very huge discovery. I'm gonna tell it when we meet each other next week. Okay? I don't want to see the ear that's so too many needles. Parang ako naaawa eh. Oo. Mayroon na-discover akong isa pa. Siguro babenta ng yun. So far, I didn't have any issues with intradermal needles. I use it for the 4-point needle technique and the back shoe, the front move. Okay, we'll teach you how to use it. And I let them sleep with it, but if they find it uncomfortable, I let them take them off. No? But so far, they haven't complained. Nagpo-fall off lang siya dahan-dahan. And then, of course, para may emphasis naman, we can probably use a better looking. So remember, you are from lab, so we have to be innovative. We don't copy. Okay? See you all. Okay. Let's continue. Men should avoid having too many ejaculations. Sir Mark, huh? Okay. And women should avoid becoming pregnant. Both sexes should avoid lifting heavy objects and overworking. You can do light physical exercise, but you should avoid training excessively and exhausting physical activity. Kasi I know someone, grabe talaga. Sabi ko, bakit parang yung tongue niya, gumagalaw-galaw na. Yung pala, he would spend like 2 hours in the gym, 3 hours, no? Then wouldn't change the shirt. And nakita ko yung gym, naka-aircon ang gym, klaseng gym. Okay. So yun. Fresh air and breathing exercises. The patient should eat foods that tonify kidney yang. Next, no other questions? This will be the last one. Dump heat in the bladder. So as you can see, ito yung UTI or make my stone. In lump, we don't say kidney stone. You say nephrolithiasis or urinary calculus. Okay? Nakataas pa kilay. Kasi may bato. Ang cheap naman. Ipatagal lang pag ano. You should say nephrolithiasis or urinary calculus. So, sinabi to urinary calculus because we haven't done the ultrasound yet. No? So, when you say nephro, we're quite sure nasa kidney yung stone. Okay? So, the classic symptoms, burning on urination, dark urine, you know the UTI, di ba? I remember somebody messaged me, ano, medyo Gen Z. Sabi niya, Doc, I have a problem. Kasi nagpa-urinalysis siya. Kita ko, parang UTI na UTI. Sabi niya, why are you so afraid? Sabi niya, I might have gonorrhea. Sabi ko, bakit ka ba nag-ano? May ginawa siyang ano, so yun. So hindi naman, buti naman. So, meron lang ano yung ay, by the way, we will also include that urinalysis. Ang dami ko na naiisip, no? O tingnan mo, you have to grow with us next year. And we welcome volunteers sa pagla-lecture. O, gagamitin ko na kayo. Sir Mark. Kasi yung iba napipilitan, nahiya na ako, pakapalan na ng mukha. Thank you ha, Doc Janine. I really appreciate that. So I would like I like the voice of Ma'am Damasco from Bukidnon. Sige lang.
Palawan.
Oo. You cannot say no na may powers ako. At saka si ano, gusto niyo ba may course tayo on nutritional medicine next year?
Sure.
Pero hindi ako matuturo, wala akong alam. Sige, I'll ask two people from the group. Surprise muna. Ayun na, madali lang oh. So again, damp heat, may sticky yellow coating on the root with red spots. Kaya nga heated. Slippery, rapid, slightly wiry. Okay, so where did this come from? Meron kang spleen deficiency or kidney yang deficiency. So if you leave it untreated, magkakaroon ka ng kidney yin deficiency. The person should avoid foods and beverages that generate damp or heat. They should avoid exposure to climatic influences that can result in damp, cold, and heat invading the body. They should also avoid stress and situations that can result in emotional frustrations. Can you imagine? Yan. Kaya yung iba parating nag-UTI, yung pala stress na stress. No? Oh, tapos antibiotics ka agad. If you work too hard physically, this will mainly weaken your kidney yang. Huh? Pero kung ano mo, parati ka na sa office, you are the CEO of a big company, and you have to work late in the evening, you leave the office, you're the last person to leave the office, and sleeping too little, kasi nga ang daming problema, this will make you lose kidney yin. I know someone, you'll meet him next week. He will come with us. Oo. Pero yun ang nangyari, ha? Medyo naging dump na. He used to be slim. Kilala nyo na kung sino yan. Okay. Ang yin natin, nagre-replenish at night while we sleep and when we rest. So if you don't have time to rest, how can you replenish your yin? No? So a person who sleeps too little and works or parties at night weakens their yin. Pwede ka mag-party once in a while. And take note, at the age of 40, na-consume na 50% of your yin.
So melatonin makes sense.
Yes, definitely. And we can have more of you next year. And also Dr. Janine, ha? Okay, you cannot say no. We're going to innovate our program. Ay, pumasok na si Dr. Raya. Hindi niya alam, pinachichismis natin siya. Hello, Dr. Raya. Good to see you. Say hi, Dr. Ryan. He just texted me. He just got in. Oh, yeah, he's there. Okay, let's welcome a person who can actually compose speeches in a split second. Hello, he just came from another web, BOD meeting. Okay. So there,
Na-improve to.
basahin nyo na lang to ha. Basahin nyo na to kasi andyan na yung ating moderator. Diyos ko naman, you can have a copy of this naman, no? Sige there.
Mhm.
Now let's go to the face. By the way, this is what I call evolution. Okay, tingnan nyo what happens, no? By the way, maririnig nyo dito boses ng Dr. Janine. So if you don't watch the videos on acupuncture matters, you don't know what I'm talking about. Okay. So this area kasi, this is about heart and small intestine, no? So if it turns blue, that means you have a congenital heart issue. Ito naman is about hypertension. Pag mapula yan dyan, okay? And this is hypotension. Okay, instead of the redness, you can see some depressions. O, kasi hypo is negative, depression. Okay? And also, we can see wavy capillaries extending on the whites. No? Okay, this one is insomnia. Siyempre, pag kulang ng tulog, ganito itsura ng mata mo, no? So, I would like all of you to be very, of course, you look at your patient's face, di ba? Oh. So, okay. Parati siya nag-log out. Okay, sige, take your time, Dr. Rai. Okay, next is when you have, headache. Okay, so these are the things that you will be able to learn. We will try to simplify this. This is when you have cervical spondylosis, yung masakit yung dito mo. Makikita mo yan sa sa cervical area sa ear, no? Ito naman, when you have frozen shoulder, see? May makikita kang flaky redness. You know, flaky, yung parang
Kaliskis.
kaliskis, yes. No? And also, here is enteritis, when you have issues with the intestine. So, tingnan mo, intestine and ito. Next, hyperthyroidism, of course, you look at the neck. Okay. And then we have, when someone has tinnitus, or tinnitus, you can see this one. But I rarely see this. Maganda kasi, like, ay, nakita mo sa ear. It's a matter of, lang, you know what to look for. And then this was not the reason why he came. Or probably nakalimutan niya. Then you would suggest, you have tinnitus? Okay. Ito naman yung you see, yung mga may problema din sa, this one when you have lower back pain. Usually may moles sila sa eyebrows. Sige, tinanod yung mga moles nyo. And then ito naman, for me, women with irregular menstruation, remember in women, the kidneys control the uterus together with the liver. So this is what you will see, red patches. Of course, you will not, okay, dysmenorrhea, makakaroon ng mga red tinge in the ear. Of course, it may pain, no? And this one is uterine fibroids or myoma. Okay? Pula yan dyan. And then, what else? Ovarian cysts. What do you notice here? For those who practice iridology, di ba, you look at the pupil as well, no? So medyo reduce yung pupil niya. So nawawala yung sex appeal mo. Yung mga infertility, the philtrum, ito siya flat, no? Sige, takpan nyo na yung philtrum nyo kung wala. Kasi some people will come to you for, di pa nagkakaanak. Di ba maganda, like after 2 years, hindi yung biglang mag-aano ha. So, di ba maganda yung feeling when you did something good, no? Ito naman for men, chronic prostatitis. Prostate area, remember? And here, no? And then, ito naman, ED or impotence, erectile dysfunction. May mga grayish white. Yung parang nalalanta na. Oo. Okay, sige lang. This is exciting, really. Then we have nocturnal emissions. You know, wet dreams? I
Mhm.
don't think the women are familiar with that, no? So, nagwe-wet dream ka, nocturnal emissions, ganyan dito. And ito, like, of course, before you do anything, you will have to look at punta naman tayo sa ear talaga, no? So, like, if you see the pale yung helix niya, so that's very deficient. Pag yellow, mayroong dampness. Greenish, may blood stagnation. This is the very famous Franck sign. When you have that, um, you have some heart issues, mataas yung cholesterol, yung mga ganon. Okay? Now, this one is Franck's crease. So I'm just showing to you the various. Ito naman, can you see this? Talagang malalim siya, deep, no?
Mhm.
So this is heart chi deficiency. Okay? Heart area yan, di ba? Ito naman, when you have low blood pressure, this is called the low blood pressure groove. You have this in the book. Ito, you cannot see the color because black and white yung picture. So, if you have suppuration, nagnanana sa Shenman, okay, that patient must have anxiety, skin rashes, nausea. Okay, ito naman, tinnitus groove or vision problem. Okay? Ito is scar on a throat point. So probably the patient has had ito naman sa ankle area, when you see capillaries, you know capillaries? Okay?
Mhm.
That means the patient has weak ankles. So in Chinese medicine, that's because of weak kidneys then. No? Kasi andun malapit yung kidney tree eh. So you were born with it. Now, ito naman, you have birthmark on the shoulder area. Okay? Okay. This one, may cervical disease. This is the neck area. No? And then ridge in the neck area. Okay? We will not tackle the other issues kasi puro heart and kidney lang tayo ngayon. And why did I talk about the neck? Because cervical vertebra is under the control of the kidney. No? Groove at the
Mm.
cervical point. And if you are smart, meron kang tinatawag na smart crest. This is indicative of high intelligence. So we presume that all LAMP students have smart crest. If not, we will cut off your ear. But then if you have this kind of ear, this will benefit more from massage. Yung ganyan. Katingnan yung mga minamasahe nyo, ganyan usually yung ear. Gustong-gusto ng massage yan. Okay. Ito naman, when you have UTI or stones, as you can see, di ba this is the Simba concha? Tingnan mo, ang dami oh, laki-laki. Oh, matakaw siguro talaga. Di ba dapat ito ano? Oo. So swollen siya. Simba concha, this is Kaavum concha. And we will be sharing with you some points to make your practice in auricular medicine much more different than the others. So, ito naman, makikita nyo, di ba we use this to locate the back shoe? So, you might want, this is from Noger. Alam nyo naman si Noger, he has his own, no? So, the Z here, that's actually the 0.0, kaya it's called Z. So, tinan natin to ha, like 13 is supposed to be your fingers. These are actually proven already, no? So, how do we find out? Like, if you have good eyesight, no, you would be able to see some mga red dyan kung may swelling, kung may pain, no? Ito
Mhm.
naman, since our topic is on the heart, okay, so tingnan nyo ha, any comments? Number one is supposed to represent the heart, the medial and lateral surface. You know what it is? This is the heart area. But if you're talking about the internal surface, yung mga may cardiomyopathy sa loob, this point is better. And if it's the entire circulatory system, this is number 3. So para siyang ano dyan, Holy Trinity. Di ba? O needle na lang all. Okay. Di ba sa atin ba, heart lang, tonify lang yung heart, but ito ang mas ano daw, mas uh, you would know the exact area talaga, no? Okay, to make it more confusing, andito. Like when you have hypertension, you use this one. Sometimes you bleed this. Okay? When you have arrhythmia, don't worry, we'll give you a copy right after. PPT format. Okay. Ito naman yung genitourinary system. Tingnan nyo, yung kidney, number 1. Andito yung kidney naman. And the ureter. So, yung mga batch 3, expert kayo sa urinary system, di ba? And then the uterus or prostate sa number 3. Sa loob yan, ha? You have naman na probe, eh. So kapag meron kang issue with your bladder, that's number 8. Okay? Representation, sige, kayo na lang yan. Okay. Mental disorder, yung mga nasisiraan na ng bait. Okay. You might be an advocate of this protocol. If the patient has anxiety, number 4. So, dito yan. Aggressiveness, you use number 8. O, tingnan natin kung magiging mas aggressive. So, if you're using something to sedate, you might as well use a silver needle, no? Okay. Maliit na yan. Okay, ganito lang, oh. Or you may want to use this. We have this in the book. Tingnan nyo, if it's stress, the shenmen, the heart, you know. You don't have to needle all of them, especially if nakita mo. Okay, for example, you would like to know if the insomnia is probably due to an issue with the kidney. So you have to try to determine which point on the kidney channel will you palpate. Excited. Hindi yung buong kidney channel pinalpate mo na. No. You should know where to palpate. Okay? So, I don't know if I can include that with you. It's on PDF form. Lahat ng channels nandoon. I'll try to make it more appealing na lang. Sige, ayusin ko muna. PMS. Tingnan nyo, nandyan yung kidney parate. Oh? Diba? Diyan yung kidney. Menopause, neck pain, kidney pa rin, cervical. So that means when you needle the ear, hindi lang enough na ano lang, puro lang symptoms. You have to also know the cause. Okay? Shoulder pain. Frozen shoulder. Ano yung frozen shoulder? It's usually due to cold and dampness, no? So kaya yung iba nilalagyan ng hot compress na relieve. So if that's the case, you have to do something about the organ that, you know, probably brought about the dampness. Could be the liver because it impacted the spleen so much, or the kidney, right? Or mahina ang kidney yang. Next, lower back pain. O, tingnan, napakadali. O, lumbosacral vertebra, kidney. So this is what I have in mind. Now, you can use ear seeds here so that we can tap the health workers. So yung mga tatakbo ng sa election, pero close na, ano? You know what? There's one, I don't know if, I'll not mention names na lang. She's running for councilor yata somewhere in Bulacan. Ay, kilala ni Doc Janine. So ito, knee pain, knee arthritis. So, gets nyo? So you use Shenmen, knee, or you need to really explore. You have to have the probe. Hindi ka kita mo niyang knee. Kasi minsan dito mas masakit or doon. So, yung pinakamasakit, yung talagang magwi-wins yung pasyente. No? Yan. If it's due to stress, you use the adrenals. Now let's go to your palm. O baka manghuhula na tayo nito ng palm. This was actually presented by si Ma'am Ma'am Joy, no? You can catch this on acupuncture matters. Okay. These are the main handlines. Okay, it is the headline, emotions line. Yan. Ito po yung normal length. So what is this again? Emotions line. This one is the headline. Ito naman, jade pillar. Okay, whatever. Basahin nyo na lang yan. So if you have hypertension, mahaba yung ano mo, emotions line. You see this one? So tingnan nyo, yung mga tumataas yung blood pressure. Sabi nung source ko, nag-change siya every 6 months. Okay. Huwag nyo naman sabihin yung future ng pasyente, nakakahiya na. Oo. Hindi na po part natin yan. We're just looking at the lines sa health. And if you have coronary heart disease, both the emotions and the headline are shorter than normal. Okay? Ito ang normal ha sa right. If you have urinary issues, prostatitis, meron kang oval-shaped sign of at the proximal end of the lifeline. Okay. Okay. Next, yung mga sa babae naman, when you have endometriosis, salpingitis, inflammation ng fallopian tubes, myomas, ovarian cysts, okay? Oh, ito yun, oh. Arrow-shaped. Sige, ay, wala pala. Okay. Then we go to ED, erectile dysfunction. Meron kang makikitang ganito, horizontal chain. Okay? And this one is, yeah. Pag may cancer, kita nyo may break siya. There are actually 3. Ito lang, at saka ito. Nag-meet siya in bit. Okay? So, I'm sure walang aamin kung sino may cancer. Then when you have ulcerative colitis, that's it. And when you have asthma, yan, in-include ko na rin. Okay? Thank you so much for your attention. Tapos na. Thank you. I'll turn off the recording first.